Splints can be used in hand osteoarthritis to reduce pain and to support the joint. There are many different types of splint. Some can be custom made and they're rigid and made out of thermoplastic material, and I've got some here that I'm going to show you. And some can be soft and allow a little bit more movement while also providing some support and some restriction. What's important about splints is that they feel comfortable for the person who's wearing them, that they're well fitted and that they don't cause any problems. Splints are often used on the thumb, so I've chosen 2 thumb splints first of all to show you. This splint here is an off-the-shelf splint, which means it's been made to set sizes small, medium and large. So therefore it's easy to provide to a patient and to be purchased by a patient if they want it. It does up round the back of the wrist and supports the wrist a little bit, but its main function is to support the base of the thumb joint. And it holds the thumb joint in a nice neutral functional position, so a position that's easy to pinch and grip in. It's soft, which allows some movement, and particularly useful if someone needs to hold on to hard objects, for example leaning on a walking stick. You can have a custom-made thumb splint as well, and I'm just going to show you one example of that. This one here is made out of thermoplastic and it's moulded by either a hand therapist or an occupational therapist. So this one slides onto your thumb and it is very rigid, it's hard, I can tap it. So once I'm in this, I can move the tip of my thumb, but I can't move these 2 joints here. The wrist is free, but if someone has a painful wrist, these splints can be made to be longer or to cover different joints. So the advantage of this is it really rests the joint, it holds it still. And that's great if you're in a very painful phase, you need to strongly settle that pain. The disadvantage of keeping a joint still is that it can become stiff and the muscles around that joint can become weak. So it is important, if you are wearing a splint, that you do seek advice and for this kind of splint have a specialist prescribe it for you and make it for you. There are lots of, you can have osteoarthritis in any of the joints in your hand, and it is possible also to supply splints for all those joints. So I've brought along 2 examples just that you might use on the finger joints. This is called a Accelerator sleeve. It's a tube lined with silicone, so it's quite soft. You can roll it onto your finger and it will cover, depending on how long you cut it, either just the tip joint or the tip and the middle joint. It's very good if you've got painful nodules on the finger because it protects them from knocks and bumps. It also gives a little bit of compression, but it doesn't stop you moving and using your hand. So it's easy to carry on with life as normal with one of these on. You can also use a rigid thermoplastic splint for the same joint that would keep that joint still and give it more rest and support. So this is one that's been made. So with this on, I can't move that joint. So it's probably more useful to sleep in a splint like this. And what's important is that you can move the joint below that and the other joints in your hand nice and freely so that nothing else becomes stiff while you're wearing it. I hope you found this video useful.